Thank you so much, Michael Vanover. Yes, we're at the Physician Center for Beauty. I'm with Dr. Sean McGuire. And Dr. McGuire, now this is, obviously you're very accomplished. I brag about you all the time, but plastic surgery is probably your first love. Don't get me wrong, some of these non-invasive procedures are fantastic, but with that being said, you're very good at what you do.
Well, thank you. You know, we have a full-scale plastic surgery practice and also the medical spa, which, you know, brings a lot of people in that otherwise haven't considered things to be done. I see all my plastic surgery consultations here in the office, and surgery is done at an outpatient surgery center.
All right, you know what I love? Before and after pictures. Okay, love to see this man's work and able to show it off, which we do here on Wave 3 Listens. Let's do it. Okay, this young lady here, well, obviously she certainly looks as young on the right there.
Yeah, so this is what's neat about this case is that this is just liposuction of the neck. So it almost looks as if she had had a neck lift or a facelift, and this is actually just liposuction of the neck, small incision underneath the chin, so no visible scar, and really made a major improvement in the contours of her neck and lower face and jawline.
How difficult is surgery like that for you, doctor?
For you, it would be difficult. No,
for you?
No, it's it's a pretty straightforward procedure from a technical standpoint. There's certainly an art to it, and neck surgery is the most common thing that I do. So, you know, we've got lots of good examples of surgery, both the less invasive procedures like liposuction and also neck and facelifts.
A stark difference. And look at the facelift here. This is what I love. I think she's a beautiful young lady before, but after, you've definitely enhanced her look. Well,
thank you. Yeah, I think this particular case was a lower face and neck lift. I also performed an upper eyelid surgery and a rhinoplasty or cosmetic surgery of the nose, and again outpatient surgery. You know, downtime consisting of about 2 weeks, just in terms of seeing friends and being out in a social setting. But really, an outpatient procedure that makes a big difference. This is just eyelid surgery, upper eyelids and lower eyelids. I think you can say major improvement in the contours, and also just a sharpening of the crease of the upper eyelid, and just looks a lot better rested and more relaxed.
You know, doctor, we've seen eyelid surgery gone awry, gone bad, and again, this person still looks like the same person, just you might not even be able to put your finger on it. You'd say they look younger, they look more alert, and all of these things are due to the little subtle and really subtle but yet dramatic results that you give them.
Yeah, I think this is subtle, but I think it's made a huge difference for her.
Oh, huge. All right, now we're going to talk about rhinoplasty a little bit here and some nose surgeries. All right, Doc.
Okay, this is an example of rhinoplasty and also liposuction of the neck combined. It almost looks as if we have done something to her chin with a chin implant. We did not. This is just liposuction of the neck and a rhinoplasty, cosmetic surgery of the nose. So major improvements there. You know, it does appear as if you had a chin implant, and I would think the reason being is because of her nose, you balanced her face, right? So it gives the illusion of a chin implant. That's exactly right. I mean, that's a great point. In profile, it all has to look in harmony with the nose, the chin, and the neck, and sometimes if one is off, it throws the other off, and oftentimes we combine procedures.
All right, a little tummy tuck here, and then now the difference here is just obvious. You know what's incredible about this is I cannot imagine that is just one procedure.
Yeah, that's just a full abdominoplasty or tummy tuck, and we were able to remove a significant amount of excess skin and fat.
Amazing.
Improve a scar that was pre-existing. And then this is a really neat case of a abdominoplasty that I did with some liposuction of the thighs and hips. And she had a large scar going from her belly button downwards, and we made a major improvement in removing that scar and just contouring the abdomen.
Beautiful work there, doctor.
Thank you.
All right, let's see if we've got another before and after. There we go, side view of the tummy tuck.
Okay, and this is a patient that really was in pretty good shape to begin with, and we were able to make some nice improvements, in some ways subtle, but I think major improvements for her overall physique.
All right, see if we have any more coming up here. There we go.
Another example of a tummy tuck with someone who's, again, basically in pretty good shape, who just needed some reduction of fat and excess skin and looseness of skin after a couple of children, but I think has a really nice result that looks natural.
All righty, doctor. Excellent work there, Doctor. We're going to go to Becky here on the phone. Before we go to Becky, real quickly, I'm reading a lot of trends about more men getting involved, especially when it comes to Botox, trying to look younger, et cetera. What would you say, Doc, is your personal experience with percentages of men and women?
Well, traditionally, it's been about 10%. Over the years, it really hasn't budged from that. We're seeing a trend upwards, but there still seems to be a taboo among some men, and I'm not sure why that is. I think it's, just cultural and the way people are raised sometimes, but I think that's turning around a little bit.
All righty. Becky is with us. Becky, sorry to hold you there. Becky, you have a question for Dr. McGuire. Go ahead.
Yes, I was wondering, I have lupus and was on a large amount of steroids, 60 milligrams a day, for over 2 years, which caused, a substantial weight gain. And I haven't been able to lose a lot of the weight, and I was wondering if this diet, the HCG, the one you were talking about, if that would be able to work to help me lose some of the weight that I gained from the steroids.
Well, first of all, congratulations on and getting through that, because that's a pretty rough course of 2 years of high-dose steroids for lupus. And the question really relates to your underlying medical condition, and HCG is not right for everybody, depending on your underlying metabolic conditions. And diabetes is one issue that has to be looked at. So something after a complete medical history is taken, we can determine if it is appropriate for you. It's not actually something that I'm able to kind of diagnose on the phone and decide if you are a good candidate, but we encourage you to come in and have a consultation.
Becky, thank you very much. Another question that we have quite often, I wanted to ask you, Doctor, is I want you to talk about some of the other benefits. Obviously, we've seen with the before and after pictures the physical appearance. But there's also the confidence factor. I think in the workplace, if you're perceived as younger, you have a better chance of maybe being, advancing at your job. Tell us about some of the advantages you hear about from your patients. Well,
we certainly, would like to think that it improves patients' self-esteem. In a healthy person that has realistic goals, I think it can make major improvements in their overall quality of life. And we're seeing, patients really regain some confidence, improve their self-esteem, in the right person that's got the right motivations with realistic expectations and goals, I think can be tremendous.
All right. Dr. Sean McGuire, the Physician Center for Beauty. It's a beautiful Thursday. Give us a call if you have any questions. We'll be right back. We're going to talk about laser hair removal.